Hey everyone, Kate Perkins here from Cancer Rehabilitation and Lymphatic Solutions and the founder of the Bounce Back from Breast Cancer program. Today I wanted to talk to you about self-management and self-massage for softening tissue post-radiation. So for many of you who have had radiation treatment, you might find that your breast tissue and your skin is feeling a little bit harder and sore to touch. So what I wanted to show you today is a couple of easy techniques to help soften that tissue. So what happens after radiation is that the body heals itself, and by doing that it lays down extra collagen fibers, scar tissue, to help heal the tissue that's been damaged by the radiation. And so what can happen is that tissue is a little bit harder and less mobile than the tissue that has not been radiated. And so what that can also do is impede lymphatic flow across the breast and away from the breast. And so in the area that you've had radiation therapy, the tissue might be harder, and it might be sore to touch, and you might feel as though that there is swelling in the breast. So breast edema, because the lymphatic pathways have been impeded by that scar tissue. So I wanted to show you a couple of techniques that I show my clients here in the clinic, and the techniques that I use to help soften that tissue. So in the clinic I use low-level laser therapy to help soften the tissue, and I use some gentle myofascial release techniques as well as modern cupping techniques to help soften that tissue, to draw away the tighter fibers, to help soften the tissue and to increase that lymphatic flow. So you're not going to have any of that equipment at home with you, but you do have your fingers and your hands to help soften that tissue. So what you will find that, again, I'm going to use my left breast here as an example, because I'm going to use my right hand. And so what you will find is that you may be tighter right at the insertion point of your pec major along your sternum. And because what happens is the tissue gets tight and it wants to contract. So it'll get tight across the at the insertion point of the sternum, and also down under, this is the inframammary area, and also the tissue can tighten over the breast membrane, so you'll feel really tight sometimes and contracted, and your breast might be a bit higher than your breast that hasn't had radiation therapy, just because the tissue has contracted. So what I want to show you is, actually I might use this side because I've got my microphone on that side and I don't want you to hear any interference. So if you can place your fingers and feel in between your ribs, so you'll feel your ribs down along your sternum, and place your fingers in between your ribs, that's the flats of your fingers, and apply a little bit of pressure, and it's like a tissue glide. So you're moving the tissue away from the sternum and you're holding. So it's not a massage that you're doing around and around and around. Place a little bit of pressure, move the tissue, so it's a tissue glide, and hold there for about 10 seconds. And then once you've been there for about 10 seconds, take your fingers off and have a feel of the tissue, and you'll feel that it is a bit softer. So start from the top of your sternum, go all the way down to the bottom, and in side lying you will find that this is a whole lot easier if you have harder tissue. So often you'll find there might be some dissection bed scar tissue, and that also is harder tissue, and radiation therapy on top of that at the healing process can really harden that tissue. So in side lying, or even with your hand behind your head, and just place the flats of your fingers, apply a little bit of pressure, and it doesn't matter which direction you take that tissue, as long as you're taking the tissue to the point of resistance, so it's not moving any further, and just hold it. And it's really gentle, and hold for 10 seconds, and you'll find that that tissue will really soften. And then go in and do your sequence of lymph node clearance, and then do a sequence of lymphatic drainage across the breast area to help move that lymphatic fluid. And the other area where you can help move and keep that tissue mobile is in the inframammary area. So you're cupping your hand like that, and you're placing it under your breast, and again you're applying pressure and pull down away from the breast membrane, and you're stretching that tissue, and so you help softening that tissue. So give those techniques a try, and if you have any questions, send me a message or pop them into comments and see how you go. Bye for now.